yet another video of FMTUT series, and the chapter name is Regional Injuries. So without wasting a single second, let's begin with the session. The very first question is, what are skull fractures? What are the 5 types? Causative mechanisms, and you have to estimate the age of the fracture. So in total we have got 11 types and we are going to learn them all. So what are the types of fractures? Number 1 is your linear fracture. See, linear fracture is also called as fissure or crack fracture. When the fracture line is a straight or curved line, it may involve the whole thickness of outer or inner table of the skull. So two things you have to remember in linear fracture, it is also called as fissure or crack fracture. And number 2, it can be straight line or linear line, it can be straight or a curved line. And number 3, it may involve the whole thickness, the distance between the outer layer of the skull and the inner layer of the skull. So that is the thing they are trying to say here. Number 2 is your radiating fracture. Now what do we mean by radiating? Radiating means something which radiates, right? So radiating fracture is also called as stellate fracture when there is branching or radiations from the main fracture line. So whenever you are going to find out any branching or radiations from the main fracture line, that is called as radiating fracture. Gutter fracture, when the fracture involves only the outer table or the outer layer of the skull and there is no cracking of the skull, it is called as gutter fracture. Depressed fracture, also called as signature fracture, when a piece of skull bone gets depressed into the cranial cavity. Obviously the name itself suggests whenever the piece of skull is going to get depressed into the cranial cavity or inserted into the cranial cavity, that is called as depressed fracture. Fifth is your elevated fracture. Now what do we mean by elevated? Without reading also people can tell. Whenever there is elevation of the piece of skull bone above the level of skull, that is called as elevated fracture. Now penetrating fracture, something is going to penetrate inside the 2 tables of the skull, right? And that something is your bullet. So that is why penetrating fracture is also called as firearm fracture. It results from the penetration of high velocity missile into the skull. The skull is punched in at the wound of entry and is punched out at the wound of exit. Now 7th is comminuted fracture, that is the skull bone is broken into multiple small pieces. Then crush fracture, also called as bursting fracture. Along with comminuted fracture of skull, there is crushing or deformation of the head or the face so that the cranial cavity is burst open. Example, when the head is crushed under the hard and heavy object or during forceps delivery. So in crushed fracture, there is bursting out of fracture, and in there is deformation. Deformation is important here of head or face so that the cranial cavity is burst open. So you can imagine whenever the cranial cavity is burst open suddenly due to hard or heavy object, then that is nothing but your crushed fracture. What did we learn up till now? We learned about the linear fracture, radiating fracture, and then your comminuted fracture, then your penetrating fracture, elevated fracture and depressed fracture, then gutter fracture also. Moving to another fracture, compound fracture. To next fracture, that is compound fracture. So the fracture of the skull bone communicates with the external environment. Number 10, suture fracture, also called as diastic fracture. When actually there is no fracture, there is just separation of the sutures. Okay. So suture fracture is technically not a fracture, that is just increasing the distance between the sutures or separations of the sutures. So that is nothing but your suture fracture. What is pond fracture? Also called as indented fracture. In infants, because of elasticity of skull, there results bending of bones and no actual fracture of skull. So pond fracture is nothing but indented fracture. Technically, there is no fracture but just bending of bones in infants. So these were the 11 types: linear, radiating, gutter, depressed, elevated. Then recall compound, suture, pond, and penetrating, comminuted and crushed. Moving to next point, what is the mechanism of fracture of skull? The first point is fractures due to local deformation. If a small mass traveling at sufficiently great speed strikes the head squarely, it will drive inwards a piece of bone shaped as cone-like indentation. At the apex of such cone, the inner table will be stretched but the outer table will be compressed, due to which the inner table fractures first. If the force continues to act, fracture of the outer table follows and the completed fracture line runs from the central point radially. At the periphery of the indentation, the bone is bent in opposite direction, and as the convexity of the bend is outwards, the outer table fractures first. So the fracture lines tend to run circularly to enclose the base of the indentation. If the injuring force is not lost, a piece of bone fragmented by the radial fracture lines will be loosened and then depressed to form a comminuted fracture. So fractures due to local deformation says, see, in simple words, just understand. Fractures due to local deformation means it is caused due to a small mass traveling at a great speed, and it is going to hit the brain or skull at very high speed, and it is going to apply force on the outer layer of the skull first. Then because of that force, the force will travel from outer table to the inner table, and if the force continues, then the fracture of the outer table occurs. So the fracture may be, the force may travel to the periphery, or it may travel to the center. Okay, so at the periphery of the indentation, the bone is bent in opposite direction. What they are just trying to say, if whenever a small object tries to hit the bone, okay, outer table of the bone, then the force is going to travel to the inner table, and that would cause the fracture of the inner table. But if the force continues to apply on the outer table, then the force is going to travel peripherally in the outer table, in the outer layer of the skull. So at the end of the periphery, fracture the pieces of bone, or say the fracture, would be facing outwards because of the force in the opposite, in the outward direction. Okay, so just understand, the force, the object hits to the center of the outer layer of the skull, fine. So now the force spreads to the inner table as well as the outer table surface. So whenever the force is very large, the force is going to travel to the outer layer of the skull, and at the periphery, I mean, obviously it will spread circularly. No, just imagine the bullet has hit the outer layer of the skull, so the force is going to spread in circular direction. So at the end of the periphery of that force, the fracture would be facing outwards. Okay, that is why they say the fracture at the periphery of the indentation, the bone is bent in the opposite direction, and as the convexity of the bend is outwards, the outer table fractures first. Uh, in this entire para, they just talked about the direction of the force. You just imagine a small bullet is hitting the outer layer of the skull, and then you can write. Number two is fractures due to general deformation. Whenever the skull is compressed, example laterally, there is shortening in the line of the pressure, while the vertical and the longitudinal diameters are increased. Obviously, imagine if you are going to apply pressure on the skull from left to right, then the vertical and the longitudinal diameters, that is from top to bottom, are going to increase, due to which the parts of skull distant from the site of application of the injuring force are bulged and may fracture by bending. So the sideways are going to get fracture. The head may be compressed between two external objects such as the ground and the wheel of car, between an external object and spinal column. The later method is common as it is seen in motor car accidents when an occupant thrown from a seat strikes the head against the resident surface. It is also seen when the body is at rest and the heavy object falls on the top of the head, driving the skull downwards onto the condyles of the atlas. So don't you just have to focus on 2 points. If in deformation due to in fractures due to general deformation, we apply force laterally, and your vertical diameter is going to increase. And they gave example here between two external objects like ground and wheel of car, and between an external object and the spinal column, that is top to bottom. So these are the fractures due to general deformation. And we also learned about the fractures due to local deformation, local in the sense to the particular area in the outer table of the skull. Yes, so this was about the mechanism of the skull injury. Now we are going to learn about the age of the skull injury. Healing occurs without the formation of visible callus. The periosteal blood vessels are damaged, delaying the development of external callus. The edges of the fissured fracture stick together within a week. The edges are slightly eroded, and the inner surface of the skull may show pitting or deposition of lime salts in 14 days. The edges become slightly smooth, and bands of osseous tissue run across the fissure in 3 to 5 weeks. So when the edges are not in opposition, they become quite smooth in 3 months, or partially healed if close together. If there is much loss of bone, the gap is filled only with fibrous tissue. Just remember 3 points here. Number 1, the edges of the fissured fracture stick together within a week. Then number 2, the edges become slightly smooth in 3 to 5 weeks. I mean within a week, 3 to 5 weeks. And if there is much loss of the bone, the gap is just filled with fibrous tissue only. So, and the most important point is healing occurs without the formation of visible callus. Okay, and skull injury. So this was about the healing and the age of skull injury. Now, what are the head injury, intracranial? I think this is another question. We were just told to write the types of skull fractures, the causative mechanisms, and the age of the fracture. So this was about the whole question. Moving to this next question, what is head injury and what are the intracranial injuries? So head injury, any injury caused to head is head injury. So head injury is a common injury during vehicular accidents, fall, and during assault, and there is no relation between external and internal damage. Injury may result to face, scalp, skull, meninges, and brain or spine and spinal cord. So according to the head injury, so it may result to face, scalp, skull, meninges, and even spinal cord. Now, what are the injuries to face? In general, we get abrasions, contusions, lacerations, insides, wounds, firearm injuries, especially suicidal, then burns, vitriolage, and smothering. So, in eyes, we get hemorrhage. Hemorrhage may collect in soft tissue around eye, spectacle hematoma, black eye, corneal injury, dislocation of lens, permanent blindness. To ears, we get bleeding, deafness, cutting of ear pinna, and to nose, we get bleeding, fracture of nasal bone, cutting of nose. To teeth, we get fracture of teeth, dislocation of teeth. To bones, we get fracture, usually of maxilla and mandible. Just imagine everything may occur in head injury. The region consisting of face, neck, head, everything you can write. To bones, to teeth, to nose, to eyes, to ears, everything. Now, what are intracranial hemorrhages? Intracranial hemorrhages may be extradural or epidural hemorrhage, may be subdural and may be subarachnoid. So epidural hemorrhage, it refers to the hemorrhage between skull and dura mater. We all know very first layer is dura mater, second one is arachnoid mater, and third one is pia mater. So the hemorrhage which occurs between the skull and the dura mater is epidural hemorrhage. Epi means above, dural means dura mater. So above the layer of dura mater. It refers to hemorrhage between skull and dura mater. It occurs due to injury only. It occurs due to rupture of middle meningeal artery. It usually collects in the temporal area, and in living, evacuation improves the prognosis. You have to remember which artery it is, middle meningeal artery, and it collects in temporal area. Now, what are subdural hemorrhage? It is the hemorrhage between dura mater and the arachnoid mater. Below it may be due to injury or pathology. It is venous hemorrhage from sagittal sinus or superior cerebral veins. So here we have sagittal sinus or superior cerebral veins, and it usually collects on the surface of the brain, sometimes on the base. Evacuation improves the prognosis. Moving to third hemorrhage, we have subarachnoid. So it is the hemorrhage between the arachnoid and the pia mater. It may be due to injury or pathology. It is mainly due to pathology, that is rupture of aneurysms, hypertension, bleeding disorders. It is arterial bleeding and it is from circle of Willis or anterior cerebral artery. So epidural was from middle meningeal, subdural was from sinuses, sagittal sinus, and your subarachnoid is from base of the brain, that is circle of Willis. So it primarily collects on the base of the brain, maybe on the surface, and the subdural hemorrhage being venous can be easily washed with water, so can be easily differentiated from subarachnoid hemorrhage. Now, what are intracerebral hemorrhages? Hemorrhages in the cerebral hemispheres may be due to injury or pathology, may vary from pinpoint to frank bleeding. Repeated small hemorrhages in boxes is called as punch drunk syndrome. We are going to learn this at the last. So, repeated small hemorrhages in boxes is called as punch drunk. What is intraventricular hemorrhage in ventricles? It is necessary, it is very fatal. Cerebral hemorrhage, hemorrhage in cerebellum, pontine hemorrhage, hemorrhage in pons. In a living, it is characterized by meiosis, hypothermia, and paralysis. So these were about the types of hemorrhages. In total, we have got 7 types. Number 1, epidural hemorrhage, subdural hemorrhage, subarachnoid hemorrhage. Then what do we have? Then we have intracerebral, then we have intraventricular, cerebral, and pontine. Now, how age of the intracranial hemorrhages can be known from how we are going to find out the age of the intracranial hemorrhages. So, it can be known from either examination of CSF, examination of clot, and by 2 things, examination of CSF and examination of clot. So, very first point is examination of CSF. So, it is immediately after the injury, that is, immediately after the injury, CSF is going to be clear. Obviously, after 6 to 12 hours, CSF is going to be pink or red and RBCs are going to be present. After 12 to 24 hours, CSF is going to be pink or red, then no RBCs. After 2 to 3 days, CSF is going to be yellow due to bilirubin, that is xanthochromia. And after 1 to 2 weeks, CSF is going to be normal. So this was about the examination of CSF. Now, by examination of clot. So remember the colors of the CSF. First, after injury it is clear, then 6 to 12 hours pink, 12 to 24 hours pink red, 2 to 3 days yellow due to bilirubin, and 1 to 2 weeks it is normal again. Now, examination of clot. So initially we'll get frank bleeding. After 1 to 2 days we are going to get clotting. If the clots are small, they get reabsorbed in 3 to 7 days. If the clot is big, after 1 to 2 weeks, liquefaction of the clot occurs. After 1 to 2 months, reorganization and encapsulation of the clot starts. And after 2 to 3 months, capsule resembles dura mater. Fine. And after 1 year, capsule is thick and fibrous. So this is about the big clot. What about the small clot? Just frank bleeding and the clot gets reabsorbed in 3 to 7 days. So this was about the hemorrhages and your head injuries. Remember, in head injuries, we have to write everything: nose, eyes, ears, mouth, everything. And in intracranial hemorrhages, if we have to write write about the not just 3 hemorrhages but 7 hemorrhages, remember, and the tests or the age examination of CSF and the examination of clot. So, moving to next question, what is torture and what are the various methods of torture? So, medical, legal, and ethical aspects. As per Hippocratic Oath Declaration of Geneva, a doctor should not use his medical knowledge contrary to the laws of humanity, that he should always respect life. Obviously, we are respecting life. Number two, even as per Universal Declaration of Human Rights 1948 of United Nations, human rights include freedom from torture. Number three, as per Tokyo Declaration, see this is MCQ, as per Tokyo Declaration 1975, a doctor shall not participate in practice of torture or other forms of cruel, inhuman, or degrading procedures. A doctor shall not provide the premises, instruments, substances, or knowledge for the practice of torture. A doctor shall not be present during the practice or threat of the torture. A doctor must have complete independence in treatment of his patients. A doctor is bound to alleviate the distress of his fellow men, and no motive shall prevail against this purpose. The WMA will support the doctor and his family in case of threats resulting from refusal to participate in torture. So these were the points in your Tokyo Declaration in 1975. Fine. All cases of torture should be reported to police. Section 330 and 331 IPC deal with punishment for voluntarily causing hurt or grievous hurt for the purpose of extorting confession or information. Then Protection of Human Rights Act 1993 in India also curbs the violation of any human rights, including any torture. The district magistrate and the superintendent of police have to report within 24 hours to National Human Rights Commission cases of rape, custodial death, or torture. Then PM in custodial death, video filming has to be done and the cassette has to be sent to the commission. Then information of arrest has to be given to the relatives and friends. So these are some ethical points regarding your torture. You can write this. Now, what is the definition of torture? This is very important Viva question. Define torture. So torture is defined as a deliberate, systemic, or wanton infliction of the physical or mental suffering by one or more persons acting alone or on the orders of any authority, to force a person to yield information, to make a confession, or for any other reasons. So, in simple words, it is deliberate, obviously. Then it can be systemic and wanton infliction of physical or mental suffering. Either it can be physical, either it can be mental. Then either it can be carried out by one person or many persons, or by persons acting alone on the orders of any authority. So everything you can write in definition, either to make confession or for any other reasons. Now, what are the reasons of torture? To spread terror, to take revenge out of jealousy, to cow down a person, to get false evidence, and alcoholism. And under alcoholism and addictions, you torture a person. So to spread terror, to take revenge, jealousy, cow down a person, get false evidence, and alcoholism and addictions. Now, what are the types of torture? Physical torture, psychological torture. So in physical torture, you're going to have beating, burning, electric current, pulling hair, suspension from neck, keeping in abnormal position, irritants. We'll see this. So number one is beating on any body part and with any object. It may result in mechanical injuries, hemorrhages, visceral rupture. Okay. So beating on soles is called as phalange. Remember, beating on soles is called as phalange. Burning by flame, hot metals, or by cigarette results in burn injuries. Electric current, usually applied on genitals or other orifices. Pulling hair, nails, tongue, teeth, breasts, and genitals leads to pain, tenderness, and local injuries. Suspension from neck, arms, wrists, ankles, mechanical injuries found on external and internal viscera at the site of compression. What about sixth point? Keeping an abnormal position. Example, keeping, standing, stopping, feet tight, hands and feet tied to a bar, edema and fatigue on lower limbs are found. Then irritants applied to eyes, nose, mouth or genitals, congestion and maybe chemical. Asking to walk on thorns, broken glass, local injury. What is ear torture? Twisting ear or slapping. So it may result in bleeding or deafness, sometimes called telefango. So remember, beating on soles, phalange. Ear torture, so bleeding or twisting ear or slapping on ears resulting in bleeding and deafness is telephano. Cold torture, asking him to lie or walk on the ice, be in icy water, local cold injuries. Sexual torture, rape, gang rape, unnatural sexual offences, intermission of foreign objects, genital injuries, pregnancy, and STDs may result. Asphyxial by suffocating, gagging. See, gagging, remember gagging term, or tying a plastic bag on head. That is dry submarine. So by suffocating, gagging, or tying a plastic bag on head, that is dry submarine. Throttling or crush asphyxia leads to fatigue, externally or internally. What about submersion of head? So submersion of head occurs in dirty and fecal water, that is wet submarine. So when you are going to tie the head of the victim in a plastic bag, that is called as dry submarine. And we are going to, when there is submersion of the head, then that is called as wet submarine in dirty and fecal water. So water and its contaminants found in respiratory system and GIT. Mutilation of face or body parts, pharmacological by giving drugs causing unpleasant manifestations. Then this was about, yeah, so these were the 15 points in your physical torture. What about psychological torture? We have got 3 points. DCC, deprivation, not giving food, not allowing to sleep, keeping him alone, keeping him in dark, keeping him in unhygienic conditions, not providing health facilities, not providing clothes. Number 2, coercion, humiliation, threats, and sexual torture. Then communication technique, communicating wrong information about him and his family. So deprivation, coercion means humiliation, threats, and sexual torture, and your communication technique. Now, what are the complications of torture? Physical, psychological, social. 3 complications are there. Physical, pain, hemorrhage, infections, scars, malunited or ununited fractures, disfiguration, impaired hearing, vision or speech, and STDs or pregnancy. Rarely death may result. Then what about psychological? Anxiety, depression, phobias, headaches, sleep disturbances, convulsions, psychosis, personality disturbances, and suicidal and homicidal tendencies. Social stigma, loss of job, rejection by community. So these are the complications: physical, social, and psychological. What about the management? Diagnosis from history, examination and investigation, treatment, both physical and psychological treatment can be given, and the rehabilitation. So these were the points in your torture. We learned about the definition, we learned about the types, physical and psychological, we learned about the subtypes of both of them, and we learned about the complications. Now we are going to move towards defense wounds. What are defense wounds? These are defined as the injuries received on the person of the victim during a spontaneous response to defend by catching the weapon or covering the part when attacked. Obviously, when you're going to save yourself from any weapon, then it is going to result in defense wounds. What is the site of injury? Most common site, this is Viva question, most common site is the dorsum of the hands, okay, or on the ulnar aspect of the forearm. So it may be on the palm in an attempt to grab the weapon, it may be on the legs if the victim has already fallen on the ground, it may be on the back if the victim turns when attacked. So these are the sites of injuries. What about the nature? Depend upon the weapon of assault. Most common are incised wounds. Rarely there may be lacerations and fractures, stab, abrasions, contusions, and firearm injuries. What about the medico-legal aspect? Presence of a defense wound would confirm the homicidal attack. So these are the medico-legal aspects, the nature of injuries, and your definition and site. Moving to the next question, what is homicide? Define, and what are the types? What is homicide? It may be caused at any place. Surroundings usually are disturbed unless the victim is taken unaware or threatened or attacked by a gang. Then what are there is signs of struggle usually present on clothes and body. There may be evidence of sexual assault on the female victim, and then there may be evidence of sexual assault. Yes, defense wounds may be present. Weapon is usually missing. Injuries are usually multiple or on any body part. This was about the homicide. Now, what is the definition? Homicide is defined as killing of a human being by another human being. Killing of a fetus is not a homicide. Homicide cannot be of an animal, remember. So what are the classification of homicide? Lawful homicide, unlawful. Lawful is justifiable and excusable. Unlawful is culpable, amounting to murder, not amounting to murder, and rash. So we are going to study lawful first. As per the provisions of law, and therefore it is not punishable, that is justifiable. Then, for example, capital punishment, that is hanged till death, killing while suppressing riots, killing while lawfully executing arrest of a person. Then what is excusable? That is which can be excused. Number 1, homicide by a child less than 7 years, homicide by an insane, homicide by one who is given intoxicant against his will, homicide by one suffering from delirium tremens. What is delirium tremens? It is a syndrome involving mental deterioration due to chronic alcoholism. Delirium tremens. Then killing during self-defense. The right of self-defense extends to while defending one's own body, defending somebody else, defending a girl being raped, and defending public property. Death while doing a lawful act with care and caution, or death during an act done with consent and for his benefit. So these are the points in your excusable homicide. What about unlawful homicide, which is not permitted? Culpable homicide. Culpable is chargeable, punishable. Refers to a homicide done with the intention of causing death or with the knowledge that this act may lead to the death of the person. Like murder. What is murder? Punishment may be death sentence or life imprisonment with fine. For a homicide to be murder, there should be malice aforethought, motive for killing, preparation for killing, execution of the plan, and when not caught, the assailant usually puts forth an alibi. Alibi is excuse. Then culpable homicide not amounting to murder. So the punishment is up to 10 years to life imprisonment. Killing on sudden and gross provocation, and attacking and killing a person suffering from pathology of viscera, that is military aneurysm, fatty degeneration of heart, duodenal ulcer, and enlarged spleen. What about rash or negligent homicide? Being rash or negligent while doing a lawful act and causing death. Punishment may be imprisonment up to 2 years or fine or both. So, rash or negligent driving, professional medical negligence, death due to anesthesia, death on operation theatre, and death during sports. What is direct death? When a person kills someone and later commits suicide. Direct death. What are honor killings? When killed because the victim brought disrepute to family or community. That is called as honor killings. So, direct death and honor killings. So yes, this was about the and defense and homicidal wounds. I hope you people understood. So revise the notes, and yeah, we are good to go for our next chapter. Next chapter would be next session would be from toxicology, and I hope you people enjoyed the session. Keep revising, keep learning, and as I say every time, until then, keep learning, keep revising.